I'd like you to meet Tony. Tony has diabetes. She also has cystic fibrosis, for which she had a lung transplant 2 years ago. Before her transplant, Tony couldn't finish a sentence without stopping to draw breath. She was mostly housebound. This is Tony now. She's back at work and has just completed a 10-kilometre hike. Tony's story is not unique. More than 150 Australians had a lung transplant last year. It's a life-saving procedure for patients with terminal lung diseases, such as in emphysema or cystic fibrosis. However, survival following a lung transplant is not guaranteed. Only 1 in 3 patients is still alive 10 years after their transplant. So why are lung transplant patients doing badly in the long term? In our transplant unit, the largest in Australia, we wondered whether diabetes could be contributing to the poorer outcomes. After all, in complex patients like Tony, management's always focused on the lungs, and conditions like diabetes have to take a back seat. My research, which is the first of its kind worldwide, looks at the relationship between diabetes and survival after a lung transplant. I took 10 years of patient data and determined whether there was a difference in survival in patients with and without diabetes. Looking back at those 386 patients, just over half had diabetes at some point. So this is a survival graph. You can see that the patients who did not have diabetes, in green, half of them survived for 10 years. In comparison, patients who had diabetes, whether it was diagnosed before or after their transplant, survived half as long. So by 5 years after transplant, 50% of patients had died. Now that's looking at diabetes alone. So of course there could be another factor which causes both diabetes and death. So I then looked at all the risk factors for dying after a transplant together. To my surprise, diabetes remained the strongest risk factor for death, and by far. Patients with diabetes had 5 times the risk of dying, no matter what other risk factors were present. It's hard to believe, but Tony's chance of being alive 5 years after her transplant were only 50%. My research is now looking at why that is and what we can do to improve her grim prognosis. The good news is that in comparison to the complexity of a lung transplant, diabetes is actually relatively easy. We have the tools to screen for and treat diabetes safely, cheaply, and very effectively. My research has already shown that it's not enough just to get patients through their transplants. With early detection and better management of diabetes, we could dramatically improve survival for patients like Tony.